Number one. Question number one is from Julie from Woodridge.
Ooh.
Julie asks, what is it like to talk to a therapist about sex?
Ooh. Scary, frightening, horrific.
And they're judging you.
They're
everything
judging
you.
you. They're most likely going to make fun of you while you're there. You'll be exposed to pornographic material on a regular basis, and you'll leave terrified.
With money out of your pocket.
Correct.
Next question.
No, I think there's a kind of a misnomer. People think that you go in and talk to a therapist about sex, and yeah, it's a little awkward, but they're trained to have these conversations, and they're using terms, like penis, vagina. They're talking about things about anatomy specifically, or they have very much experience with different types of situations, So typically people come in to a sex therapist or a therapist that they want to talk to about sex with specific problems. Let's say, I don't know, like erection issues, right? And then they come in and they talk to a therapist about this, and the therapist will dig further and kind of start to investigate what's going on. And 9 times out of 10, if not 10 times out of 10, that is not the actual problem. They find that the man is having erection problems because he's having conflict with his wife, and then you start to have this conversation about how you communicate better, and all these things go on, and you get to the root of the problem, and lo and behold, the erection comes back. Also, I think a sex therapist will first rule out physical. So I mean, if they'll ask you probably if you've seen a doctor recently, there's probably going to be some kind of questionnaire which can get pretty involved.
Sure.
Which is in your best interest to fill out truthfully.
Yeah, that's one of the things about sex therapy is if you're going to go and see a sex therapist, you got to be as honest as you can be,
Yes.
because otherwise there's really no point to it. You can beat around the bush as much as you want, but you're kind of wasting your own time anyway. So it's kind of weird just getting into the nitty-gritty of it, but that's what they're there for, and whatever you share with them, they have probably heard before. So it's a time of honesty and trust, really, that you kind of got to obtain pretty fast, but they're trained in it, and it's something that's beneficial. But yeah, there's a difference between physical ailments and psychological ailments, and sometimes they intertwine. So like Ingo said, the therapist will rule out physical ailments, because why are we going to sit and talk about emotional issues if it's actually something that can be treated by a doctor or a physician? So that'll be ruled out, and psychological issues are always shown through body, somatic symptoms. We don't realize it, like hair loss, right? When someone's stressed out or depressed, they can lose their hair. There's always a reason behind it. So that has to be ruled out if it's something that needs medical attention first and foremost.
Yeah, and I mean, I know people get nervous about this, but I guarantee you, there's very little chance that the therapist you go to see has not heard of your problem.
Sure.
And definitely they will not judge you. And a lot of times I think they do a really good job of kind of normalizing your situation. And if you go in even just once, you might feel a lot better about the fact that, hey, I'm not the only one in the whole world who has this issue,
Right.
So there's always that.
Yeah. And the field of sex therapy is very wide and very large. So clearly issues are not uncommon. So just
Absolutely.
kind of keep that in mind.
Yeah.
Okay, normalizing things.
Thank you, Julie, for the question.
Thank you, Julie. Hope we helped.
Yes.